In Lusaka, a group of young people is actively working to educate adolescents and parents about HIV. Their goal is to increase the access to clinical treatment and contraceptives.
Our mission has been to engage more with traditional healers and also to educate them more on the importance of them bringing adolescents and young kids to the hospital in case they have symptoms of HIV and other symptoms that might likely be HIV.
Medical professionals help the youth in engaging traditional healers and teenagers on misconceptions surrounding HIV and antiretroviral drugs.
More especially with the adolescents, they don't have the full information about ARVs. They don't know to say when you are put on this treatment, you prolong your life. Because remember, we've got 5 goals of therapy. While we're talking about reduction of viruses in the body, improvement of life, and also improvement of the immunological functioning.
In Zambia, many people visit traditional healers before going to clinics, and it's no different for young people.
We have seen that the adolescents believes that it's good to go for a traditional healer than to just visit the healthcare for their services, and that they believe that ARVs would be taken for life than where they are just given some traditional medicines by a traditional healer, which will just be taken maybe in a short period of time.
Most youths in Kanyama believe that sexual reproductive health and right issues such as maybe HIV and all that were mostly spiritual.
But it's a problem that also goes beyond the Zambian capital.
With an estimated 1.4 million people living with HIV and 1.1 million undergoing treatment, Zambia has an 11.1% HIV prevalence rate. 50% of Zambia's annual recorded new infections are among adolescents and young adults. UNICEF asserts that continuous oversight is necessary regarding the financing and execution of Zambia's existing laws and regulations. Less than 1 in 5 teenagers are using HIV testing or contraceptive services, an indication that access is still low.
To enhance healthcare services for the community, the youth are now looking into whether the local clinics are able to meet their specific needs.
So we go undercover, we disguise ourselves as young adolescents, accessing services. We get to hear from them if they are rude or anything. We write a report and then we discuss again about it.
Efforts to tackle HIV in Zambia have long been hampered by a lack of information on proper medical treatment. Now young people are bridging that gap to tackle an illness that places them at higher risk. Fungisai Moronga, Africa Matters, Lusaka, Zambia.